So we've got our client here who's allowed us to film having a very small cyst removed. He's been anaesthetised insofar as local anaesthetic has been applied to the area. And if you zoom in, what we have is we have 2 cysts, one larger and one smaller, which we're going to remove for him today. His skin's been cleaned, everything is sterile, so we are going to get going. If anyone is squeamish, I suggest you look away now, because normally this can get quite pussy. Okay, so can you feel any sharpness at all?
No.
So we make a small incision. And the idea with the cyst is we want to not just remove the pus, we want to remove the sac, because what cysts do is they sit in a small sac, which is what stops them from disappearing. So I'm going to squeeze now. So this is all the pus from inside the sac that's coming out. You okay?
Yeah.
Now you can see that little bit of fibrous tissue there. This bit here is our sac. So what I need to do is give it a squeeze. Sometimes they squeeze out, sometimes I need to just chop them out a little bit. Well done. Gone. That is how a cyst is removed. And then, although it's tiny, the little incision, we keep them as small as I possibly can. I am going to pop a little stitch in there. The stitches I use are absorbable, so they will dissolve over the next couple of weeks. Make sure that everything's fine, nothing else coming out. Obviously, the bigger the cyst, the incision will need to be a little bit larger. Okay. Dab. So if you're worried about having any little skin surgeries done, most of them are very, very easy and straightforward. Even the larger cysts, in fact, sometimes the larger cysts are easier to do. The principles will apply. The incisions might be a little bit bigger and there might be a couple more stitches, but job done.
Well.